I started taking care of people with hemophilia in February of 1978. That was really a turning point in the treatment of hemophilia. The federal government had recognized in 1977 that having a comprehensive care team to take care of people with hemophilia resulted in much better outcomes. And so we were one of the original 30 or 40 federally funded hemophilia treatment centers in the country. We spent a lot of time getting children who had previously been in handicapped classrooms mainstreamed into regular classrooms. I spent a lot of time teaching patients and parents how to self-infuse factor at home so they could live normal lives. We did a lot of orthopedic surgery to repair damaged joints that patients had had, and we were really trying to make life normal for people with hemophilia. And then HIV hit. People with hemophilia don't bleed any faster than anybody else. They just don't stop when they're injured because they're missing one of the essential clotting proteins. People with hemophilia don't bleed from superficial cuts and scrapes, as is mistakenly often thought, because their platelets, which help seal the superficial blood vessels, are fine. But people with hemophilia tend to bleed into their joints and their muscles, their large muscles. They tend to bleed into the large joints of knees, ankles, elbows. What happens is the blood is a terrible irritant to the joint, and the blood irritates and eats away at the cartilage. And the patients develop essentially an osteoarthritis. When I started, most of the patients, the adult patients, were unable to walk or really work, I should say. They weren't able to work, while the children were often in special classrooms because they missed so much school because of their bleeding episodes. Women don't generally have hemophilia factor 8 or factor 9 deficiency, although there are some women who are carriers who have a lower than normal factor 8 or 9 level and who are impacted. But there are other congenital bleeding disorders, primarily von Willebrand's disease, which impacts, because of the inheritance pattern, it impacts both men and women equally. I think the women have been welcomed in the hemophilia community. For example, at summer camp, we try to have as many girls as possible with bleeding disorders come, because the girls, even if their bleeding disorder is milder than the boys with hemophilia, once they get their menstrual period, it can be quite severe. There's a lot of data out there about chronic illness and the impact on the families, and the incredibly high divorce rate among parents with a chronically ill child. And that's true when a child develops cancer. That's true if a child's born with something like hemophilia or cystic fibrosis or sickle cell. It's very difficult on the family. The mother often becomes the primary caregiver, and the father often feels that they didn't get a lot of attention. We've had fathers who've been very disappointed. You know, they had dreams of having a son that they could go camping with, that they could play football with, you know, all of that. And they, you know, those dreams are shattered if the child can't do those activities. It's really hard on the siblings too, on the siblings who are unaffected, because all the attention goes towards the affected child. It was a progression of treatment in the 50s and 60s, but the treatment was either whole blood transfusions or fresh frozen plasma or cryoprecipitate, which is also a blood product, but those were products that needed to be infused in a hospital or in an emergency room. And it was quite time-consuming, and patients often spent most of their lives in the emergency room getting transfused. So it was very difficult for people with hemophilia to lead a normal life. Things have radically changed for hemophilia now because of the availability of clotting factors that now many of the patients take several times a week on actually a preventative basis, and some of the kids these days have never had a bleed. 1982 was the first year that it was reported that people with hemophilia were developing AIDS, or whatever it was called at that point. And these were adults, they were heterosexual, they had no other risk factors, and so people were trying to figure out why was this happening to the hemophilia community? You know, it wasn't until like 83, 84 that it was identified that AIDS was a virus. So there was a lot that wasn't known, but it was well known that the factor products were made from pooled plasma from paid donors. And it was well known that the factor products also were contaminated with hepatitis. So it didn't take long for people to realize that it was the blood products, the factor products, that contained the HIV. A lot of what contributed to the factor being contaminated was the method that the manufacturers used to collect plasma. Plasma was collected from paid donors. The manufacturers was saying, oh yes, we go to college campuses. Well, no. They went to jails, the seedy part of town. I remember many years ago, we got a letter from somebody, an anonymous source, who sent us a diagram of all the different shops on Polk Street, Lower Polk Street, and where there were gay bars and gay sex clubs, and right next to them were the plasma donor centers. In addition to the location of the plasma donor centers, a lot of IV drug users like to donate plasma, because then if they're stopped and they have needle marks, they can pull out their plasma donor card and say, no, I'm not shooting drugs, I'm donating plasma. And the manufacturers will say, well, you know, we had to have, we use paid donors because we wouldn't have gotten enough plasma from, the volunteer donors. It probably would have helped if they had had smaller pools. They pooled plasma from tens of thousands of donors. And so, if you have one bad apple in there, it contaminated the whole lot. There was a lot of fear, there was a lot of anger, and there was a lot of denial. And I remember early on, even the healthcare providers, the physicians and the nurses, were just so upset that this was happening. And these patients who, we had taken care of for years and years and raised and nurtured were all getting sick. And it was just devastating. And I remember some of the doctors would say things like, well, it's not going to affect all the hemophilia community because the way that the factor's manufactured, it's, inactivates the virus. Well, that wasn't true. And people just kind of didn't know what to do. Some hospitals would say, don't treat, and so that you won't be exposed to HIV. But a lot of the patients, the older patients, had lived through the era when they couldn't get treatment, and they knew how painful and debilitating it was to have a bleeding episode, and they said, I don't care, AIDS can't be that bad, I'm going to still treat. And then it was very devastating to families who were treating young children at home because the factor that they were putting into their child's vein was ultimately what's going to kill them. It was pretty devastating. There were a lot of lawsuits around the country. Patients were suing not only the manufacturers, but they were suing their treatment centers. And then many of us, we had patients die like every week. Every week, every 2 weeks, there would be another patient who died. It was a bad time. It was a bad time. This was the medication that was supposed to change everybody's lives and save lives and make life normal for people, and it turned out that that's what was going to be killing them. It's very difficult to say what could have been done differently in the early 80s because the science, to some extent, just wasn't there. It took them a while to identify the HIV virus. It took them a while to figure out what kills the virus in blood products. I remember one of the doctors saying early on with the heat-treated factor, well, we don't know if that's going to become a carcinogen. Hindsight is always wonderful, but it's very difficult to say. You'd have to really take a close look at what happened when